Hello. Talking is so important when we are looking after people. Sometimes this can be asking someone what they need. But if someone is very unwell, they may need family members and carers to speak on their behalf and say what is worrying them. You may feel that someone you care for isn't their normal self and may be becoming unwell. It can be difficult to tell others that you are worried, especially when you are speaking to someone you don't know, such as a doctor or a nurse. SBARD structured communication tool is used by lots of people in health and care as a way of helping you to get your message across. SBARD stands for Situation, Background, Assessment, Recommendation, Decision. Evidence shows that using SBARD helps with sharing information, confidence, and making it safer for patients. Start by explaining the current situation. Introduce yourself and say who you are. Explain where you are calling from and give your telephone number in case you get cut off. Give important information about the person, such as their name, date of birth and address. Explain what it is that you are worried about. If you have been able to take any measurements, such as a person's temperature or blood pressure, then share that as well. Don't worry if you can't take any measurements though. It is more important to make the call. Briefly explain a bit about the person's health. This may be to say they have a learning disability or perhaps a heart condition. It really helps to be able to say what medicines they are taking. Some people have a list of all their tablets, but you may know where the boxes of tablets are kept. And this can help, but again, if you are worried, don't spend lots of time looking for the information. Some people have had a conversation to say what they want if they become very unwell. If you know this has happened, and the decisions have been written down, it is very useful to be able to share this information. This is where you suggest what you think might be going on, and what you think is happening. If you aren't sure what is going on, don't let this put you off saying you are worried. Now think about what you want to happen next. Do you want the person to be seen by a doctor or a nurse? If yes, how quickly do you think they need to be seen? Try and explain what you want the person you are talking to do to help you. You can also ask what you should do before help arrives. Finally, before ending the call, make sure you are both clear on what each of you will do to care for the unwell person. You may need to write this down so you have something to check if the situation changes. Try practicing using SBARD every time you're giving someone information, and soon it will become much easier to do. It may even be helpful to print off the SBARD checklist to help you remember what to say. Remember, using SBARD will help you to get your message across clearly and safely.